cervix with scars or other lesions, dysplasias, can develop cervical cancer, and operations is with only removal of the cervix is difficult to perform. Technique is very difficult. That's why you need to investigate the cervix in any case, yes, if it is myeloma of the cervix or any lesions of the cervix. Abdominal examination we use, it is palpation of the abdomen if the fibromyome occupy large size. Of course, you look and check the mobility of the tumor. Immobile, usually it is specificity of malignant tumors and endometriosis, adenomyosis of the uterus. Of course, the great method of investigation, very useful in this case, it is ultrasonography, where we can see the number, the size, localization, echogenicity, and the structure of these fibromatous nodes. And if it is submucous fibromatous nodes, you see here, it is hysteroscopy, optical examination of the uterine cavity. Differential diagnosis with ovarian tumors, first of all, yes. Then usually with the tumors of the intestine. Sometimes for us it's very unclear because intestine every time near the uterus, yes, and that's why maybe tumor of intestine looks like as a tumor of the uterus of the or ovarian tumors. Treatment of uterine leiomyoma, it is multi-component and determined by the age of the patient. Maybe conservative, maybe operative. Conservative, non-hormonal methods you see here, usually it is symptomatic treatment, but pay attention to this, which we name conservative but looks like operative treatment. It is uterine artery embolization and hormonal treatment using of progestogens, yes, androgenic steroids, gonadotropin releasing hormone, differilin, buserelin, zoladex, which promotes the stop of menstruation and decrease of the size of fibromyomes. We suggested these methods for women who want to save the pregnancy. And now it is the embolization of uterine arteries. Usually, a method based on the conduct of the subsequent pelvic arteriography with selective embolization of the small branches of the uterine artery supplying the nodes, resulting in focal infect, hardening, and gyalinization of these nodes. Embolic agents are used polyvinyl alcohol particles with the size of 350 to 700 microns. Embolization. How we selected these patients. It is reproductive age, I told you. If the woman, for example, have no children and don't want to remove the uterus. Mena and metrorrhagia, it is bleedings. Pain present. If the woman has contraindications for hormonal therapy. Absence of severe anemia. It is infertility, I told you, yes. Habitual miscarriage if the woman has, and contraindications to surgery. Contraindications, it is pregnancy, of course, acute inflammatory disease of the pelvic organs, renal insufficiency, malignancy, maybe allergic reaction to contrast drugs, coagulopathic diseases, and size, very large size of the fibromyome, more than 10 centimeters, and general size of the uterus more than 13 weeks. If it is 13 weeks, the size of the uterus, guys, it is indication for operative treatment. And guys, pay attention to this. You have one test when the woman not all to my mind in Krog test, but has increase of the uterus to 12 weeks of gestation and fibrinal cystic to my mind, fibrocystic hyperplasia of endometrium. Of course, we have pathological hyperplasia of endometrium plus large size of the tumor. It is indication for surgery, operative treatment. To my mind, you have this test in your Krug test. They can describe your submucosal leiomyoma. If it is heavy prolonged bleedings accompanied this tumor together with anemia, it is also indication for operation. Rapid growth of tumor, it is the sign of malignization and indication for operative treatment. Some words about the rapid growth of the tumor. For example, to you came woman and the size of the uterus as 4 weeks of gestation. The next year she came to you and the size is 4 weeks of gestation. Increase of the tumor prolong a year to 4 weeks, we consider to be quick growth of the tumor. Subserous fibromyoma on the needle or on the leg. We recommend it for the patient operative treatment because it looks like as a bomb or in the organism of the pregnant woman. In any minute, for example, due to physical effort, due to torsion, for example, or trauma or break, it's maybe torsion of this fibromatous node on the needle, and we receive at once the clinical picture of irritation of the peritoneum, developing peritonitis if we don't do the operation in time. And that's why more better to remove such kind of fibromyoma according to the doctor's plan when the woman came to the clinic, prepare for operation, and we remove this tumor. Necrosis of the node, it is the indication. Dysfunction of related organs, cervical leiomyoma, infertility, it is indication for operation, and combination with other diseases. Guys, I stop my demonstration and will meet with you no, 6 minutes and again begin our discussion.